Hospitals are tapping into lines of credit that they typically didn't like to tap into. It's there for emergencies, and this is an emergency.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today, we're recording our fourth special edition of the Business of Healthcare podcast related to the topic of COVID-19. We're fortunate to have Dr. Britt Berrett co-host these special editions as we look closely into the current and future scenarios related to COVID-19. Our topic today is about the financial impact from the current epidemic. No better person to join Britt than Dan Karnuta. Dan comes to UT Dallas, like many of our faculty, from industry. He's the former CFO of Conifer Health Solutions, a revenue cycle management company serving over 800 healthcare provider organizations throughout the U.S. Dan, welcome to the podcast.
Thanks for having me.
Well, Britt, we're all concerned about the economic impact of this epidemic, and you've been working closely with Dan on this topic. Where do we start this discussion?
Thank you, Bob. It's a delight and pleasure to be with you on this podcast. It's an interesting time and place, and the importance of revenue cycle can't be understated. To that end, Dan has had experience with Conifer Health and has dealt with the revenue for these big healthcare organizations on a daily basis. No better person to start asking important questions that are above maybe the line of sight of most people. Dan, tell us a little bit about your background and give us an idea of where you're coming from and also your role here at UTD.
Yeah, as Bob said, I was CFO of Conifer Health Solutions for about 7 years. But before that, about 20 years, I worked for Perot Systems. And at one point, I was CFO of their healthcare division, amongst other things that I did for them. And prior to that, I spent the first part of my career with Price Waterhouse before there was a Coopers involved in that name. So my background is in accounting and tax. And I spent a lot of time, in that area, obviously becoming a CFO, but also in operations. So being a CFO of the revenue cycle part of companies, of hospitals, I also got a really good insight into just the operating finance of the hospital business itself, both the hospital operator, our parent company that I was CFO of Conifer, our parent was Tenet Healthcare, that owns many hospitals around the country. So I got really a firsthand insight from the decision-making team on how those hospitals operate.
Most recently, legislation was passed, a $2 trillion economic bill. Talk to us a little bit about what the impact will be and what you foresee as a result of this legislative effort. And then let's pivot from there and talk about what do you see as the future? We want to talk a little bit about the distress economically that's being placed on healthcare providers.
Yeah, and I think the best place to start there is to say that the current environment's not impacting every hospital operator, every provider the same way. It kind of depends on where you are. If you're in New York, you're in crisis mode. Certain parts of New York. Certain parts of New York State aren't. Certain parts of New York State are very crisis mode. Other parts of the country are not crisis mode at all. And so they're having to figure out what to do with their business in a time when nobody's coming to the hospital for electives, which is their biggest margin driver. So this has really forced hospital management to really get out of their comfort zone and get into their crisis management zone. And as you guys know, as you, especially Britt, as a hospital operator, hospital executives that's what they do. They prepare for crises. So where this is a difficult situation and it's not catching them completely off guard, and it's not really out of their comfort zone as far as preparing for, this type of a thing. So the actions or the playbook, that I've seen out there being used by hospital systems revolves not only around the $2 trillion act that we saw passed, and I'll talk about that in a second, because that's certainly one of the prongs. I guess I'd look at the prongs as a three-pronged fork that hospital operators are using. The first being the operations, just daily operations. What are they going to do to conserve cash and create cash flow in these uncertain times? And the first thing is you attack your operating areas, and there are things like furloughs. Hospitals around the country are putting staff on furloughs. This is difficult for people in New York to understand, and maybe parts of Louisiana and now Detroit, but other parts of the country, there's excess capacity, empty beds in hospitals. So they're suffering just like other businesses and having to put staff on furloughs because they need to reduce their costs and maintain their cash flow just to operate. They are delaying capital expenditures, IT expenditures, marketing spend, and just general cost reductions. Things that aren't completely necessary are being cut.
Let's pause for a moment there, Dan, because you point out something that's very important. Healthcare organizations, multi-million-dollar operations, they're not only cutting costs, staff, letting people go, not giving hours, but into the future, they're going to have to do even more dramatic and drastic things to retain viability. And we don't know what those are, but they're going to have to reduce their expense side significantly to account for the lost cash during this pandemic.
Absolutely. And there's a couple of comments there, Brett, I'd have. First of all, this actually is an opportunity for hospitals, providers, and a lot of them are looking at it that way. Every business wants to make itself as lean as possible as far as, wringing out costs that aren't completely necessary. And so they're being forced to do that today. And so a lot of these costs that hospitals were spending on ancillary activities may not ever come back. And that's not necessarily a bad thing for the economics of a hospital. And the second thing I would say is that I think right now the prevailing thought is that this is creating a pent-up demand. These elective surgeries, a lot of them they're going to happen. It's just not now. So when things do free up, and there's going to be a release of this CapEx spend, this IT spend that needed to happen right now. It's not happening, because of the fear to maintain cash flow.
Interesting.
So anyway, if I can continue, I'll go through to the financing prong of the fork now. So you cut costs and you try to maintain your cash flow through normal operations, and then you exercise any financing opportunities you have. Lines of credit. Hospitals are tapping into lines of credit that they typically didn't like to tap into. It's there for emergencies, and this is an emergency. So a lot of them are tapping and trying to increase their lines of credit, and they're also trying to just borrow. They're going out and trying to borrow in this environment, which, believe it or not, the Fed has done a really good job of maintaining liquidity in the investing industry. So there is money out there, and it is being lent to hospitals today. So it's not completely dried up, the lending that hospitals have the opportunity to go and get. And then, so we got operating, financing, and then finally there's the CARES Act, and government. What have they done? And boy, the playbook is kind of long there. As you said, it's a $2 trillion package. So hospitals got about $100 billion of that specifically. So hospitals are doing things like Medicare Accelerated Payment Program. That has been put into place where hospitals can actually get an advance payment from Medicare on their Part A and Part B payments. So they basically take a 3-month or 6-month look back on what their spending has been or the reimbursements have been from Medicare, and Medicare will give them. They'll file for that. Medicare will give them that funding up front, and then it'll be paid back through future Medicare reimbursements. So that's cash that's made available to hospitals through the CARES Act. And the CARES Act is all about liquidity, keeping hospitals liquid, having the ability to access cash. The $100 billion is also available for incremental costs and lost revenues. So lost revenues, so elective surgeries and incremental costs due to COVID, hospitals can file to get paid by the government and never have to pay that back. Now, the issue they're having right now is how do they file? What's the best way? How do we get it back? The CARES Act is relatively new. That money is not flowing like a spigot right now. But hospitals, the big hospital operators have the staff, the experienced staff to work with the governments and the secretary to figure out how to get their money the quickest. It's the smaller hospitals that don't have that experience that find that harder to tap into.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
We've been talking about hospitals, right? They're a third of all the spending in healthcare, so it's easy to talk about them monolithically. But there are smaller facilities or unaffiliated facilities that aren't part of a bigger system, or small businesses, physicians' practices, imaging center, freestanding ERs, who are kind of on their own. They're small businesses, and they're in trouble. They are going to be in trouble because they don't have the liquidity, meaning, they want to pay for all their salaries, but they just don't have the money, and they don't have access to some of this big funding through government. They have to go to local banks and such. Do you anticipate some changes as a result of these dynamics within the smaller businesses that are out there?
Well, that you're right in that's where I think there's the most pain right now is at that level. So think of surgery centers and dentist offices, physician practices. They fall into the small business, a lot of them, the small business category. And you're right. I mean, they're just struggling. They don't want to lay off or furlough their staff, but they've got no choice. I mean, there's only so much cash in the bank, and the CARES Act has funding in there, over $300 billion of funding in there for them, so they can apply for loans to pay for their staff, to keep them employed, and operating expenses like rent. They can apply for loans to cover that for about 2.5 months and not have to pay it back. As long as they don't start firing the staff, they never have to pay that back. But again, the issue that they're having is getting to that money. So filing the right form is getting to the banks. That's the issue that they're having.
I think that's a dilemma that we're going to see. Small businesses don't know how to navigate. Well, none of us know how to navigate. We've never done this before. This is a reaction to a pandemic. And I worry that small businesses will get caught up, unable to access the capital, and they will roll under or be acquired. So I'm of the opinion you're going to see a lot more consolidation in the markets. You're going to see a lot more integrated delivery systems who have the cash strength ability to navigate through this hardship. They're going to start looking at smaller facilities and saying, come be part of a bigger system.
Absolutely. Some will never come back.
Yeah.
In the form that they were. Now, I mean, I think those physician practices and those dental offices, I think they're going to get the funding. I think that the funding is going to start to flow, and that's really going to help. So as long as, we figure out the recovery, how do we get out of this? When the COVID pandemic is to the level where we can start business back up, how quickly can those practices get back, and how quickly will we as consumers of healthcare be willing to go back into a doctor's office? We're afraid right now. How long will that fear last?
Yeah.
So that's going to really define, how many of those practices go under. One dentist will merge with another dentist, maybe that type of thing. Yeah, I think you're absolutely right. There's going to be changes.
There are going to be a lot of change and innovation. I was listening to a couple of experts on this field, and I asked the question, which systems will be successful? I mean, where will you see success? And their conclusion is the leadership. Organizations that are willing to innovate and try and do and change and modify will be the successful organizations in such a changing world. And organizations that are stuck in old thinking will suffer immeasurably. And so I think we probably should keep our eyes on healthcare providers, suppliers that are willing to try innovative ideas. I got a text message yesterday from my provider saying, "Hey, how you doing? Oh, and by the way, we've got telemedicine if you'd like to sign up for a visit, Mm-hmm. And my wife says, "Well, do we have copays and deductibles on those?" And I said, "Absolutely." This is, and that's what we're probably going to see into the future, a much more innovative approach to the delivery of healthcare.
Yeah, and I think we might see physicians rethink the self-employed model versus going and being employed by hospitals. I was talking with an anesthesiologist in Richmond, Virginia the other day, who happens to be very, very happily employed by a rather large surgery center. He's happy that he's an employee. He used to be, an independent working for that company, and he's saying that the owners are. I mean, they didn't sign up for this. Nobody in a management position signed up for, this type of an issue where they're worried about having to lay off staff and volume just dropping off to zero. When's it going to come back? How long can we afford to go on? How big is our cash balance? Those are the primary concerns of the day, rather than, okay, how many patients do I have stacked up to do knee surgeries on, or whatever they're doing.
It's interesting. The University of Texas at Dallas, at the Jindal School of Management, we have been focusing on the business of healthcare. That's been our focus. Well, we combine clinical application and policy. We have, such as yourself, faculty that are industry leaders and have been in the chair doing what they're doing. We're looking at the business of healthcare, and it's going to change. So we've talked about a couple of those changes. Let's reemphasize a couple. Dan, what 2 or 3 things do you anticipate, in addition to what we've discussed so far, do you think we'll see changing in healthcare? We've talked about consolidation. We've talked about liquidity and cash flow. We've looked at innovation, some new innovative ideas. I've touched on, leaders have to lead differently in a new healthcare world. Anything else we can add to that mix that speaks to what the future may hold?
Well, yeah, I think the way that organizations, healthcare provider organizations, think about really 2 things. The first is their supplies inventory.
Yeah.
What they're going to be redefining, what is excess inventory? Because, part of, financial management 101 is you want to have just enough inventory on hand. You don't want your money tied up in a bunch of, N95s, for Pete's sake, that are never going to get used. Well, wish we had them now. So I think they're going to redefine things like that, and they're going to redefine their supplier networks. There's a lot of GPO, general purchasing organizations out there that help hospitals purchase in groups to save money. I think those guys are going to become even more relevant than they are today. They're very relevant today, but even more so after this. And then, so I think looking at inventory, and then I also think looking at financing opportunities. So companies, healthcare companies that don't have revolving lines of credit where the banks are basically guaranteed to lend to them should they need it. I think they're going to look at those more seriously, and perhaps if they don't have them, they're going to get them. If they do have them, they're going to increase the amount of the lines of credit that's available to them.
I'd add to that. I agree with you 100%. I'd add to that the use of predictive analytics on activity within the healthcare sphere. Too often we've allowed, volume and activity to just materialize. So you go to a doctor's office and you'll wait, 2 hours. And, my point being, I can get into Chili's for dinner faster than I can to see my doctor. We're going to have to use predictive analytics and a wise queuing modeling to help us understand what the volume and activity is. There's a faculty here, a member, Dr. Howard Dover. Dr. Dover is in the sales department. And so he and I were having this conversation about how do you project volume? You're in sales. You're trying to, communicate a message and entice individuals and move volume. He goes, yeah, there's a lot of models. And I said, could you do this for the COVID? Could you use predictive analytics on COVID? And he goes, yeah, if we understood some of the dynamics and some of the elements, we could do a much better job. And so I'm of the opinion that we're going to use much more predictive analytics on patient activity. And the other where I think that we're going to have to focus on is cost accounting. We're going to have to figure out how much it costs us to do what we do. And McDonald's knows how many pickles and how many slices of buns they need. We don't do that in healthcare. So when we look at a surgical procedure, we guesstimate, we do our best to analyze, but I think you're going to see much more attention to cost accounting. How much does it cost, and reduce variation and reduce that deviation from the mean on procedures. So it's a new world for us and an exciting one. So Dan, Professor Karnuta, it's just a delight to have you with us. We're grateful for your insight, your professional experience that is translating to the classroom. I think the students are enriched because they have individuals such as yourself that have sat in the seat and can give them perspective as we move forward into the new world.
Thanks. It's great to be part of the team.
Well, gentlemen, this has been a very insightful and rewarding conversation. We know the healthcare system, we're being graded by the public. What we've done in the past has often been criticized. Britt, as you pointed out, sometimes things aren't as ideal as we'd like for them to be. And how we lead this pandemic and how we are leaders in this pandemic, it'll help create a new view. And how we manage this adaptive change and innovate, that will determine our future as well. So Britt and Dan, thank you for these insights. These are the types of things that we'd like to share with our audience. We do have a broad audience. There's a lot of dynamic changes taking place, a lot of variables. The ecosystem is huge. It goes beyond the hospitals, and it really flows out into everybody's life. And our purpose here is to try to help inform and educate and bring to the front and center these important issues. So thank you both again for being part of the Business of Healthcare podcast.
Thanks.
Thank you.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.